Hello, welcome to the Oral Health Podcast. So after talking to Martha yesterday, we're now going to spend the next 2 episodes talking to people that have lived experience of eating disorders and discussing with them how their eating disorders impacted their oral health and vice versa. So today's episode, I'm talking to Tina. Now, Tina's a mother of 4 and she was diagnosed with anorexia early on in life and is now well into recovery. But she spends a lot of time working with people who are in healthcare and being a patient representative to tell people exactly how they can help people with eating disorders. And she understandably had an awful lot of insight to share, and I really hope that you enjoy the conversation and take as much out of it as I did. Thank you for sitting and having a chat with me. Do you want to give a little introduction to yourself? Just a little bit of information about you.
Yeah. So my name's Tina, and I'm a mum of 4 grown up children now. And I struggled most of my teenage life and a lot of my adult life with anorexia, eating disorders, and obsessional exercising behaviours. I'm fully recovered. I can stand and say finally. I have written about it in a book as well to help other people, and I now train people in mental health and eating disorders across the world actually. So yeah, and I also work in an educational establishment supporting students who are struggling. So yeah, I'm every day to me is such a privilege to be able to help other people with what they're going through. So yeah, so this is all very important to me.
That's amazing. Sounds like you've got your hands full as well.
And I love every second of it, Sophie. I'm so privileged, honestly, I really am.
That's amazing.
Yeah.
So just to give a little bit of background, so National Smile Month this year, we are focusing a lot of our time on nutrition and diet and how the things that we eat can affect our mouths. Because we are spending so much time focusing on that, we also wanted to speak to people who have had experience with eating disorders so that we are not excluding a huge, group of people that this advice can be beneficial to, as well as we want to try and help dentists approach the topic of eating disorders with a little bit of sensitivity and feeling like they can go into the conversation knowing how to approach it. So if you're okay to, can you just tell me a little bit about how your experience with anorexia has affected your dental health and your oral health?
Mm-hmm. So I think it's a very complicated picture because our oral health outcome as we get older, it's obviously changing all the time, but a lot of our whole life up to that point is impacted on our oral health. So if you've brought up in an area with fluoride, fluorination, no fluorination, how your oral health was at home, what your education was around these things, if you were involved in the child smile at school, like there's lots of things that impact it. However, at a certain age, I was addicted and lived only on Diet Coke and Diet Pepsi and all these kind of diet products with 0 sugar. And I used to drink all those. And I knew that I could see the impact it was having on my teeth over time. And I was eventually hospitalized into a psychiatric ward as a teenager. And I had a lot of health issues with my teeth at that point as well, because I was being sick often. I was eating a lot of laxatives and like chewing these laxatives and things. So I was neglecting that side of my oral health. Although I was still brushing, I was acutely aware that things were changing in my mouth. So whilst in the hospital, they actually had a dental unit in the hospital, and I'd have to get fillings and so on whilst I was in that hospital. So I was quite lucky in that sense. However, through the whole time, I didn't really care whether my teeth eroded and what happened to them, because I always thought the dentist will fix it or somebody will fix it later on. So as the years have gone on, things have just got worse. And when I started to eat things that were very high in sugar and, take things like that. So that then had a bigger impact as well all the sugar things I was taking and going back into normal eating, for me, it had that impact. So my teeth were always being attacked. So now the legacy of all of that, even though, believe it or not, I wanted to be a dentist when I was younger, so I was acutely aware of oral health and hygiene. I've always brushed and flossed, always looked after my teeth. You cannot mitigate against bad diet for me, and the way I neglected my teeth with just brushing them every 2-3 times a day. It hasn't stopped the impact. So now I'm in a position where I'm about to have several more teeth taken out. I've lost a few already. They've been capped in the past and with crowns, but they have just eroded as well because they don't last forever. So now I'm left with either getting implants or dentures, as in a plate going forward. So it does have an impact orally, and it does affect everything about you, like your ability to smile. I have no confidence with my teeth. I haven't done for many years. So yeah, it's awful. I now look at people, and all I think is, gosh, I wish I had teeth like them. I wish I had natural teeth in my mouth. Well, that photo of me is when I had all my teeth. It's very much an obsession now. So yeah, it's really heartbreaking when I know what people have gone through with eating disorders and so on, and the impact it has had on teeth. So it's so good that these things are being heightened and awareness being raised, because it's a very important topic and subject.
Mm-hmm. No, I completely agree. When you were in the inpatient facility and when you were suffering most with the anorexia, how did you find that the eating disorder impacted how you took care of your mouth, or did it impact how you took care of your mouth? Because I know you said you were brushing and flossing regularly.
Yeah. Mm-hmm. I was, as I say, I was always very aware of looking after my teeth, but so I didn't neglect those. But what I did do was part of my anorexia experience was regression. I wanted to go back to a time where my life was simple and trauma free. So I would use baby toothbrushes and get like baby toothpaste and things like that. So I probably wasn't using the right fluoridation and things like that at the time. Also, I developed lots of infections in my mouth, as in my tongue was black often. So they would give me these lozenges to try and help that. But because I was so obsessed by calorific values, I refused to take the lozenges and so on. A lot of dehydration, a lot of malnutrition has an effect. I was very aware of it on my tongue, my breath. I developed some abscesses in my gum. These things were ongoing, and I knew exactly why. But I suppose, although I was brushing, it was like it felt almost futile, but I did it because I knew it was the right thing to do. But I knew very well the impact it was having on my mouth. But to me, the anorexia was more important than really caring about the long-term impact on what I was doing to myself that way.
When you went to have dental visits and dental checks whilst you were suffering with your eating disorder, how did you find the dental visits and the experience of going to see the dentist? And were they generally understanding, or how did they make you feel about the state of your mouth?
Do you know what? This is really interesting for me now. Why I do look. I've been 11 years now as a patient representative on clinical trials, especially for pediatric clinical trials, because to me, not one dentist ever said a word to me, even though I was there all the time, growing up. I had, right up until recently, not one dentist said anything to me. It wasn't until this past year I got a scan of my whole mouth by this dental practice, and the dentist sat me down and says, we need to speak about the pattern in your mouth, and I have some concerns. Do you have an eating disorder? And I says, you know what, in all these years, you're the first dentist to ever ask me that question. I says, however, yes, I did. I'm been in recovery now for many years, but it's so sad that you are the first one to ever ask me that question. So no one's ever said anything. but they must have known, because it literally is a view into what's going on health-wise. Someone must have spotted or seen or even seen signs and symptoms that were going on me generally, physically, mentally, and all sorts of things. But not one person ever said anything. And it's such a shame, because it's a great opportunity for that conversation.
Mm-hmm.
Somebody could have noticed and maybe helped me a little bit by, being called out, sort of thing, but no one ever did. So no, it's not until now that someone's actually finally asked me that question, which is really quite sad.
It's really interesting as well, is that, yeah, that's such a recent conversation. But why do you think that is? Do you think there's a reason behind why maybe they didn't?
I did a talk at a big conference that was in my local town through the British Dental Association, and during the kind of lunch break, we were able to go and speak to lots of different dentists, and they were saying that historically they have been a little bit nervous to ask the question, because they didn't have enough information to deal with an answer that came, and plus the time. If you've got a 10-minute checkup, where if someone starts saying, well, actually, yeah, and you've got 10 patients away to come in the next couple of hours, it's so difficult. I mean, it's hard enough for a GP, and they only get a couple of hours training in medicine. So I don't know, I suspect there's even less with an eating disorder when you do your dentistry. So I think a lot of it is that, it's just that fear, because it is a very complicated picture. And it's like all mental health conditions, actually, people have been scared to ask a question because they really don't feel empowered enough to deal with an answer that may take them longer than a few minutes, or they feel it's a lifelong commitment, or whatever their fears and stigmas are. I think a lot of it's to do with that, sadly, but I think we're getting better, and I'm hoping that I'm trying to push for some research actually to be done into the impact on eating disorders with oral health, and why oral health versus mental health. For example, oral health, you go every 6 months, usually, not in COVID times, of course, but usually you would be called, and if you don't come, you get a warning and you get into trouble, and it's one of those appointments you never miss. And yet mental health, no one ever gives you a call about that. No one ever says that you need to speak to someone about this every 6 months. And to me, it's all part of the same thing. Your head is part of your body, and your brain is all there. So it needs to be seen as one thing. So yeah, it's a big deal. But it's very interesting to me that after all this time, not one dentist ever said those words to me until now, which is amazing.
And it's good. It's a sign as well that I think it's getting more empowerment behind them, and being able to approach the topic and feeling able to start that conversation with a patient. It just shows how much the breaking down of stigma has come. It's got a long way to go, but it's moving at a nice speed, hopefully.
Well, I think it's not a blame, or it's not a fault or anything. It's just a very complicated picture. I mean, you might have a patient who's a child, and they might not want their parent to know, but you've got all these kind of guidelines and parameters and things you have to work within. So it's a very complicated picture. So I absolutely have sympathy for a dentist in that position. I don't know how I don't know how you get around it, but I hope that one day there will be definitely a barrier reduced in that picture frame right there.
Yeah, absolutely. So tell me a little bit about this research that you're pushing for, because that's sparked my interest listening to you mention that. What's that entailing?
Yeah, well, I think I was on a call recently with I was involved in the rapid response for the AGP, the aerosol generated procedures during COVID. And there was a lot of people from all over the UK involved in these calls. Again, I was the patient representative on that. So it was fascinating. And again, I was putting in my, 2 cents worth, so to speak, about there's people struggling right now with eating disorders that may need urgent oral care, but they can't have it because dentists aren't allowed to do aerosol generated procedures, which is, of course, you need. And I kept saying, where's the research supporting that the impact, where is this research? And no one was ever able to say anything. So I've spoken to a couple of professors since then in the past couple of months, and we are going to look at starting something like that soon, hopefully. I can't say too much about it because I don't want anybody to pinch all my ideas.
Yeah, of course.
But yeah, because it is so important, and really there needs to be evidence-based clinical work there, so dentists know about it and what to do, and all those outcomes to be presented. So everybody's singing from the same hymn book, because dentistry, like everything else, they all have different ways of doing things. Even if it's if it's taking out some of a decay or doing a root canal, everybody has it, whether you use a rubber dam or not, everybody has a different method of doing things, right? So it's about making it consistent and like this one perspective from a clinical, evidence-based, methodically done research. So this is what I'm interested in getting and doing with some people. So watch the space, Sophie.
I will. I'm making a note of that to keep an eye out for that, because it sounds really interesting. I look forward to seeing what comes of that.
Yeah, me too. So fingers crossed, all goes through. We'll wait and see.
Yeah.
We'll wait and see. You know what it's like. You know what it's like at these trials, getting fundings and everything in place. So.
Oh yes.
Yes, we'll wait and see.
Brilliant. So if we can just circle back a little bit.
Yeah.
Using all of your experience and the knowledge that you have, what advice would you give to a dentist that suspects maybe their patient has an eating disorder or has a history of eating disorders, in terms of approaching the topic and being able to be in a position to help the patient through the symptoms that they're having in like a sensitive manner? If you could pass on any advice, what would it be?
Well, I think you hit the nail on the head there. It's about sensitivity and that discretion, but also making the patient aware that and that they're in safe hands. But oral health needs to be really taken care of, because it's all part of your if your oral health is neglected, you can become unwell. There's so many things can come of that, and it affects your mental health too, having toothache and lack of confidence with your smile and so on. So I would say to all dentists that, and it needs to start at the education level in their course. It needs to be in there so they understand what they're looking for, signs and symptoms, and they also need to have that other CPD training in there from perhaps psychologists to what happens when you ask a question, how to deal with that, how to do it appropriately. But from my own perspective as a lived experience person, I would say ask the question with sensitivity. Just say, look, sometimes, people with these kind of problems that you've got, whatever it may be, it's because there's something going on with an eating disorder. But I would just ask the question, because they'll know more than anybody what's going on in the mouth. And then hopefully the patient will understand that you're just trying to help them, and you're also going to try and mitigate any further damage and erosion or whatever's going on in the mouth. And you would give them good advice on how to maintain a healthy mouth, so they don't end up with huge problems further down the line, because that will and does happen. So yeah, that would be my advice to dentists. But it definitely has to start back at the beginning in the training, when they're doing their dental degree, that's for sure.
Yeah, I 100% agree with you there. And I think that's good advice, and approaching something with sensitivity is always the best way to go.
Also confident, like knowing that it's in confidence. But I think the tricky part, and I can't advise on this, would be how you deal with a young person who's maybe only 12 and their mum or dad is sitting outside, or their carer is sitting outside, and how does that, because you can't just say to that young person, you would maybe need to make the parent aware, or whoever's with that child. That's a tricky situation right there. So that is a big barrier, because obviously over 16 is a lot different. A lot of damage may have already happened by then too. And it's about building a good relationship with that patient, that they can trust you. Because if you can trust a dentist to look after your teeth and make sure you're okay and you're not going to be in pain with an injection or filling or whatever, because there's a lot of fear with dentists, and it's the same consistent relationship with the dentist, then it will be easier to have that conversation too with the patient, and they will trust you. And that's one of the keys, I think, with everything is trust.
That was Tina there talking about her experiences with anorexia and how that affected her oral health. If you are listening and you want to know more about eating disorders, or you want to access eating disorder support, please visit beateatingdisorders.org.uk, or you can call their helpline, which is open every day of the year, on 0808 801 0677. For more information about National Smile Month, please follow us on social media at Smile Month and at Oral Health Foundation on Instagram. You can also follow at Dental Health Org on Facebook and Twitter. And if you'd like some dental health advice, please call our helpline. The helpline number is 01788 539 780. Thank you for listening and enjoy the rest of National Smile Month.